Hi, I'm Eric Paulitch. I'm an occupational therapist and co-owner of UP Rehab Services.
And I'm Tripp, physical therapist, co-owner of UP Rehab Services. And we'd like to have you join us for a coffee discussion about therapy in our company.
Let's do it. Well, and that's the whole thing is like we sat down 20 years ago and I remember thinking it was a good idea. Yeah. Because when you look at what we do for a living and as therapists, the industry doesn't always treat us, in my opinion, that great. Employers don't always value us and what we bring to the table.
Yeah. And we had a different vision, right? We understood that. We wanted to respect our clinicians, respect what we do. And that's the reason why we started this company 20 years ago now.
Professional pride.
Yes, exactly.
It means a lot because when people are confident in the people who they work with, they do better. And when you don't feel valued, you don't want to bring your best to the table every single day. Yeah. That was kind of the way I was feeling. Yep. I was a little burned out. It felt to me that the company we were working with didn't want us to be creative, independent thinking. It was paint by numbers.
Yeah, exactly.
And I didn't know how that translated into getting the individual better.
Yep.
It was a concern for me. So,
yeah, correct. And exactly. We had the vision to provide better care, right? More one-on-one time spent with the client and building them up to achieve their goals that they wanted to achieve. And we felt that it was definitely warranted that we needed to look out elsewhere because the company at the time we were working for was not going to do it. And so that was our vision. And we opened our practice 20 years ago. It's been a lot of fun. And we've built our practice all over the UP of Michigan, and we have some more growth opportunities in our company to have people join our team, fellow physical therapists, occupational therapists, speech therapists, and athletic trainers to join our company. And we'd love to have you join our team to come work for us in the UP of Michigan for UP Rehab Services.
If you're looking for an opportunity to work for a company that's a therapy company that's ran by therapists who understand what you do, who value what you do, who want to help you get better at what you do, then I think you should come on up. Come on up to the Upper Peninsula. It's a great group and it's a family up here. The team that we've put together, we've put our own, what would you call it, our own stamp on it?
Yes.
Where we've worked with each individual. I don't know, how many companies out there do you think an employee can pick up the phone at
yeah, I know what you're saying.
6 o'clock in the morning.
Call the company owner, right?
And ask for guidance, ask for direction, ask for an ear.
Yep, exactly.
And work together.
And Eric and I are still working shoulder to shoulder with fellow therapists, working every day in the clinic. You know, like I said, we were all over the UP, but we do participate in each individual day, working shoulder to shoulder with fellow therapists, treating patients on a daily basis.
Absolutely.
And we respect every individual clinician as well as a patient to the point where we only provide 45 to 60 minutes of treatment per patient. So it's one-on-one time. You don't see 30-minute treatments and you see 10 to 18 patients or 20 patients in a 10-hour day or 16 patients in an 8-hour day. We're going to see 8 to 10 patients in an 8 to 10-hour day. So we try to be more consistent with that, and we feel that that's more value to the patient each and every day that we treat them. So
if you can structure your day around the needs of your patient, you're going to be okay.
Yeah, correct. There's an old saying Eric and I used to say, if you do what you expect to have the patient do for them each and every day, everything else will fall into place. You just provide the best care possible when you treat these patients, and everything else falls into place. And that's what we're finding. Community engagement, patient engagement, physician engagement, developing a team around providing the best care possible. And that's what we do each and every day. And we enjoy it. We still have a passion for it. Like I said, I've been a therapist for 30 years. I've been in private practice now for 20, and we're still having a blast doing it. So.
We used to be so young.
I know. Good point, eh? Yeah, you're right. Yeah, the white beard tells us the age, but we're still having fun doing this.
We do.
We enjoy every day. We treat the patients we take care of. And we enjoy working with fellow clinicians, new grads, anybody to join our team, working collaboratively in a fun team environment, research-based. We're always collaborating with best care possible to each one of our clients so that each individual clinician doesn't feel on an island. We want them to be a part of a team, and that's what we pride ourselves with. So come join our team at UP Rehab Services. Thank you.
Yeah.